But I want to also, if I can, use this opportunity today to release this document, which is Putting Patients First, which is Victoria's contribution towards national health reform. I think you know that since we've been elected, we've made a huge commitment in health funding. We've boosted recurrent funding, in fact, by 130% in the 10 years we've been in office. We've employed more than 10,500 additional nurses, 3,150 additional doctors. We've invested almost $6 billion extra in our hospitals and health infrastructure. And I'm proud of all of the new hospital infrastructure that we've built across the state. And whether it was the Berwick Hospital that we did in our first term, whether it's been the Austin, whether it's been the Women's, whether it's been the commitment to Box Hill, whether it's the magnificent new Children's Hospital that's under construction, all of these things separate out this decade as a decade of building and achievement in our healthcare system. And of course, we've also delivered critical reforms to improve health system outcomes and performance, such as our hospital admission risk program, HARP, which again I think is regarded as the best of its type in Australia, and indeed Work Health, where we've led Australia in rolling out preventative health checks across the workplace, and where we're arguing now for a national expansion of that system. And in summary, what Putting Patients First does is the following. Firstly, it proposes straightforward financing. That includes seeing the Commonwealth lift its effort to match that of our state and that of the states generally, and in lifting their effort, returning to the old partnership, the successful partnership of 50-50 funding. In Victoria's case, that would mean the Commonwealth lifting their contribution from 41% of hospital funding to 50%. That would represent an injection of funding of $1.2 billion per annum into our state. Second feature of Putting Patients First is real accountability. Under our plan, Australians will know who is exactly responsible for health care. And under our proposals, the state and the state alone will be accountable to the public and to patients for patient care. The third element of Putting Patients First is it contains action to keep people well. We've got hospital admissions that are growing across Australia at 10% per annum. The reason they're growing at 10% per annum is because our population is growing, our population is ageing, we have too few aged care beds, and we also have an epidemic of chronic disease. No health plan can be complete without tackling these drivers of hospital admissions. And so our plan includes actions to invest in prevention, in primary and in aged care. In other words, preventing poor health and unnecessary hospitalisation instead of just waiting for people to get sick. Our plan also includes new national standards through what will be an Australian Health Pact. This would be a first for Australia. So those standards would be set out and agreed nationally, and every Australian, every man, woman and child would know exactly what standards are expected in our health system, through our hospitals and in other preventative programs. And finally, of course, our plan includes improvements to the building blocks of our health system, improvements to the workforce. You've heard us say that we need 200,000 additional trained professionals over the next 10 years across Australia. Technology, e-health and innovation. So all of these things are part of our plan to give us the most comprehensive and best reform of our national health system since the establishment of Medicare in the early 1970s under the Whitlam government. Our government is ready to strike a deal at COAG. We've always played a constructive role in getting the best possible outcomes out of COAG. But we want to get a deal that's the right deal. We want to get a plan that's the right plan. We want to make sure it's a plan that offers something to patients now and not in 4, 5, 6 or 10 years' time.